Good afternoon. I'm Dr. Randhir Kumar, endovascular neurosurgeon working in Care Hospital, Nampalli. Friends, we all know that we are going into the 7 months of this pandemic called COVID-19, and everybody is aware about it as a respiratory disease and what are the protocol for the isolations, quarantine, and the treatment. But today, as a endovascular neurosurgeon, I am giving you some detail regarding the neurological aspects, or we call it as a brain stroke during the COVID-19 times. As everybody knows that it's a COVID-19 is a respiratory viral infection which involves the lungs, and it causes the respiratory distress and then the treatment regarding protocol of the ICUs and other. But what are the risk factor for the developing of the brain stroke in the COVID-19 is about 1% to 6% of overall patients. There are many data and studies worldwide and India also. Let's find out that the category of this COVID-19 brain stroke patients, they have divided into one young stroke patients who are less than 45 years, and other are the more in secondary groups who having the some of the comorbid symptoms like diabetes, hypertension, sedentary lifestyles, smoking, and other factors, those who can cause the brain stroke as without COVID-19 also. So we find out during this time of COVID-19, there are many patients, particularly here we want to discuss regarding the young stroke patients, those who have not any symptoms. They coming with the casualty with the symptoms of strokes. I will discuss in detail the symptoms of strokes coming to the casualty, and when the HRCT and COVID test is getting done, they found out to be positive. So this group of patients, those have no prior any problematic or complications or any comorbid factor to develop the strokes, but they are primarily due to the COVID infection. This brain strokes is occurring in many young patients. Secondary, those who are already admitted in hospitals, they are also developing the problem of brain strokes or other deep venous thrombosis or cortical sinus venous thrombosis, where the thrombosis of the venous sinuses of the brain. So what are the causative factor this leading to this strokes in both age group, young age group and old age group? So as we all know, this is a viral infection which causes lot of problem in our respiratory or in the lungs and in the other part of the blood vessels. We simply in the common man term we tell it causes thickness of our blood, so that there are small thrombus develop all around the body, maybe in the legs also, which is called deep venous, in the lungs also, and in the brain artery. So smaller arteries get clot, or even the bigger artery also get blocked. We call it as a ischemic stroke, or where the supply to the one part of the brain is stopped. So what the symptoms will start? Symptoms, the patients we generally call as a FAST, F-A-S-T. F means the face, the one side of face will be, what will happen, it's become paralyzed or numb, or somehow the deviations to opposite side. A means arm, what will happen, arm will be stop working. S is basically speech, where there is the dysarthria or difficulty in speaking, and T is the time. So what happened, why I am emphasizing more on the time? Because the treatment during this COVID time, where there are not many hospitals, so-called COVID hospital are stroke ready hospitals. So what happened, if you reach within the time, generally time limit is 3 hours to 4 hours to 5 hours, up to this time reaching to the acute stroke patients, we can revert back. There are many treatment for the acute stroke where we can revert back the symptoms up to absolutely normal. So I'll discuss regarding this treatment policy of the acute stroke in during COVID time and or during non-COVID time also. So we are now equipped with we called acute thrombolysis or acute thrombectomy, where we, after undertaking all the precautionary measure of the COVID what protocol we can take it. So we get the MRI. First we have to diagnose that which vessels is blocked. So urgently we take the MRI, where we find out MRI brain, we find out which vessels is blocked, either it's smaller vessels or bigger vessels, and according to that we decide our treatment protocol. If the smaller vessels are there of the brain, we give the thrombolysis treatment, that is called the TPA, or other medical other with give by the peripheral veins. If the major vessels is blocked and the patient is hemiplegic, is aphagic on going down, then in that cases we are taking the patient to the cath lab, where cath lab is the area where we do, everybody know about the heart angioplasty and the any cardiac angiogram. For same as in cath lab, we do the angiogram, where we do a small puncture in the leg artery, femoral vein. From there we go to the brain. We see that which artery is blocked, and we have special catheters, suction catheters, and another stent where we pass to the clot and take out the clot. So it is on table acute emergency treatment, and the patients, majority of the patient recover immediately after these procedures are there. So this type of treatment is available, but challenges is what? During this time of COVID, every hospital is turned into the majority of the COVID hospitals are there, and nobody wants to entertain this type of a stroke patient. And majority what they are doing, and we are going through the COVID test for other tests, and during that time the vital time is lost. And we all know that time is brain. If it's a patient is coming with a stroke, we have more than 3 hours or 4 hour treatment window is gone, then this patient is not going to recover. Then it will be permanent disability of hand and leg and the face also. For that we have our treatment or stroke protocol. Whenever the patient either is COVID or non-COVID, we take ultimate precautions, and we do first saving the brain, and rather we give the treatment for the COVID is there. If we try to do the save our the COVID treatment and other things, then the vital time will be lost and the brain will be lost. So our main aim is there to save the brain within 4 hours time, then do the protocol treatment for the COVID, either patients in the ICU or non-ICU, and other treatment to be started. So that are the main challenges during this time, where all the majority of the patients who are developing stroke outside, they are not able to reach the hospitals because of the COVID test. That test takes about 12 hour to 24 hour test to get the results, and during that time the more golden period of the brain thrombolytic treatment has gone, and after that there will be certainly there is no recovery of the any aphasia, means speech loss, or the loss of the function of hand and leg. So ideally today we have all where the data regarding the one of the major New England Journal Medicines and other data are showing, whenever there is a patients which is coming to the stroke patients, there is hardly any times. So for saving of this patient's window between 3 to 6 hours time is there. In that period we have to not much loss in the giving the treatment for the either primary COVID or giving more treatments towards or more investigations toward the COVID. That patient should be treated on urgent basis there. Now the other part of this risk factor we are discussing, what are the risk factor we can avoid it, or what are the precautions we can take for this developing of brain strokes. I mean right now we are in this era of the pandemic of COVID-19, and majority of the infection induced brain strokes, and the precautionary as the same. If the patients who is taking the precautionary measures by wearing a mask, although with the social distancing, and all others in the young patients by doing the vitamin D3 and vitamin B12, proper rest and proper exercises, I think we can avoid some of this problematic complications of or problem of the brain stroke. In other patients, those who are having the comorbid conditions like diabetes, sedentary lifestyles, uncontrolled hypertension, uncontrolled diabetes, or any other factor, in that cases we are where starting the early starting of the antiplatelets, or we call it the blood thinner tablets. What happened, this blood thinner tablet giving you some relief, and majority I have seen the patients, those who are on anticoagulants this time, if they are developing the stroke also, that is the very minor. Okay, so precautions and for the both the either non-COVID time or during COVID time is absolutely the same. But yes, during this time we have to be much careful, because we are seeing young patient with strokes, and that is very disabling for the society, because once it sets and we are not able to do the treatment within 3 hours to 4 hours time, he will be remain lifelong paraplegic and hemiplegic, and that is a burden for the family and the burden for the society also. So my request with all is there, so whenever give awareness to the other of your society members, whenever the patient is developing strokes, try to reach to the try to reach to your nearest hospital, those who are we called as a stroke ready hospital, as early as the possible, because brain is the time. If you have time is gone, brain is gone. Friends, for more this type of doctor advices or opinion or any other things, please subscribe this channel. Doctor Advice YouTube channels are there. There are a lot of public advisory health related videos are there. Please subscribe it and go through it. Thank you.